Very big welcome to all of our attendees this morning. Obviously, to start off with, as we know, the tips to continually prevent COVID-19. You do know this. Just as a reminder to please wash your hands regularly. Try use soap and water if you can instead of sanitizer. But if soap and water is not available, you may use an alcohol-based hand sanitizer throughout the day. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Cover your cough or sneeze with a flexed elbow or tissue and then throw the tissue into the bin. Clean and disinfect frequently touched objects and surfaces, and then do your part. If you have not made a decision yet to get vaccinated, then maybe you can see if that is a possibility for you. These Toolbox Talks obviously brought to you by IOPSA, designed and presented by myself from OHSS Consulting, and they are also accredited with CPD points. So if you haven't had a chance already to claim your CPD points from SIOSH or PRB, please do so. Follow your SIOSH or PRB method for claiming those CPD points. Well, coming up for October, and today we are looking at ergonomics. Next week, we'll look at safety files. What do you need? What type of safety file do you need? And then lastly, can you actually do safety on your own? And we are going to answer all of these questions during our Toolbox Talks this month. If you would like to contribute to what you hear on these Toolbox Talks, please get in touch with us. Obviously, our details are there on the left-hand side, safety@iopsa.org or info@ohss.co.za, or send me a WhatsApp on the 071-875-2070 number. Tell us what you want to hear in these Toolbox Talks. Any questions you might have, any concerns you might have out in the industry, or perhaps you just want to start a discussion on a specific topic concerning health and safety. Please remember, we want to keep these Toolbox Talks concerned around occupational health and safety, and also on positive things. We really want to bring to you safety thoughts that are upbuilding, that assist you, and also assist the industry as a whole. But thank you very much for joining us this morning, and let's get straight into it on what is ergonomics. Now, the ergonomics regulations, which came out in terms of Section 43 of the Occupational Health and Safety Act, was published by the Minister of Employment and Labour in a government gazette. And this was gazetted on the 6th of December, 2019 already. And basically, they said that all companies, self-employed, employed persons who have any employee that is at risk of ergonomic hazards must implement an ergonomics management system. Now, what is ergonomics? We had this discussion in March of this year, and obviously we have more discussions with you individually. Many of you have reached out to us. We've already done some of your risk assessments for ergonomics. We've come out to your site and we've taken a look at how you're doing your work and then designed the work for the employee. And this is really what ergonomics is. Now, a little bit of International Ergonomics Association jargon. Ergonomics is the scientific discipline concerned with the understanding of interactions among humans and other elements of a system, and the profession that applies theory, principles, data, and methods to design in order to optimize human well-being and overall system performance. Well, let's put that simply. Ergonomics is the process of designing or arranging the workplace, products, or systems so that they fit the people who use them. Now, the goal of ergonomics is to create a safe and comfortable, as well as a productive workspace, bringing human abilities and limitations into the design of the workplace. Now, what are these hazards that we are looking at in terms of the design and the workplace that we are looking at? It's awkward postures, bending, compression or contact stress, forceful exertions, insufficient rest breaks, lifting, lighting, noise, pushing and pulling, reaching, repetitive motions, static or sustained postures, and then temperature extremes, as well as vibration. Now, speaking to you plumbers out there in the industry, many of you are using rock breakers. We look at the time of how long you use a rock breaker for, and not just the PPE that you are using to protect yourself, but what is the actual effect on the human body? You see, depending on how long you are using that rock breaker for, the vibration of that rock breaker could cause effects later on, health effects to your hands, to your arms, to your nerve systems, to your muscular skeletal system. All of these things need to be taken into consideration and provided into a proper risk assessment. And that risk assessment will give you a good management plan on how to manage this type of hazard. We also look at temperature extremes. Here in South Africa, we are no stranger to temperature extremes. For many of you working in ceilings, we can just imagine how hot it must get inside a ceiling that has no ventilation normally. And on a very hot day, working inside a ceiling, well, the temperatures will soar. What about working inside a confined space? We look at the confined space hazards. Yes, obviously you're looking at things like ventilation, which is also part of an ergonomics risk. But what about the lighting inside this space? Now, perhaps you are climbing down a manhole and there's not sufficient lighting inside there. What about the comfort of working inside the manhole by bending or stretching while inside that manhole? Well, all of this is a risky situation. And we understand that we cannot eliminate all of these risks. And you must understand that when we come out on site, we are not going to eliminate the need for bending. What we are going to do is evaluate if the job needs to be done while bending. You see, a lot of times work can be done on a workbench outside of the confined space and then carried into the confined space and installed. So the bending is now only for, let's say, half an hour of the time compared to 3 hours of the time while working inside the space. And this is really what we are trying to achieve, so that the stress of ergonomics is not as bad as what it currently is. Now, you do not need somebody like ourselves to come out and perform this ergonomics risk assessment. You can do it yourself. Perhaps if you need assistance with it, you might need to call a specialist to come in. But really, you are the subject matter experts in what you perform. The work you perform is known by you and your employees. So it's very important then to perhaps put an ergonomics plan together or a management system together by discussing all of this information with your team and coming up with the following 5 steps. First of all, number 1 is you need to identify your leadership and stakeholder engagement. Now, leading organizational change requires a clear understanding of the stakeholders. These are defining the roles and responsibilities. So who is going to be in charge? And please remember, for any ergonomics program to be successful and sustainable, so not just successful now, but sustainable for the future of your company, all companies need to know where they are today and where they want to be tomorrow. So it's a very, very good idea for management or leaders to be involved in this. Do not leave it to your employees to implement this type of system. Management, employers, if you can, please be involved in the system. This will help you to define your ergonomics process with a good backing. So once you've defined those roles and responsibilities, then you have a cross-functional team. Now, in order to have this, again, you must have support of your top leadership. No system, occupational health and safety, ergonomics, quality management, none of these can work without the support of top leadership. You need to be involved, and not just involved, but actively involved. Then communicate and have this commitment communicated through proper written policies, participation, this active, again, involvement in your system, and then also ensure that the committee that you set up to design the entire system is perhaps chaired or even managed by yourself as an employer. And then take a look at appropriate resources that you perhaps need. I mentioned earlier a workbench. Now, when we got to the site of one of our plumbers, we realized a workbench would solve a lot of their problems. And this was a very simple design workbench that folded up and fitted into the back of their bucky. It was pulled out, it had wheels, lockable wheels, and it could move around the site fairly easily. But this allowed a person to stand in a position where it was comfortable to work on the actual plumbing installation. Once the work was done, the workbench was then packed away. Now, I didn't get the accurate figures of exactly what it cost this person to buy it. I think they actually got it designed and manufactured by a friend of theirs who actually works with wood and steel and things like that, and it was able to adjust. It was a beautiful workbench, actually. And this workbench apparently cost them about 2,000 Rand. So that was give or take a couple of $100 here or there for the wheels and things like that. So let's say maximum 3,000 Rand. Now that's a lot of money to just spend on a workbench, but the amount of stress that it relieved from the employees was massive. So sometimes we need to look at the appropriate resources, not just personal protective equipment. PPE is the last resort in the defense against hazards and risks that we are facing. It has its place. We must put it in its place. We need to look at the hierarchy of control, the elimination, the substitution, the isolation, the administrative controls first, before we take a look at personal protective equipment. This means we need to put in what we call in health and safety Pdca, Plan, Do, Check, Act. This type of observational control, where we plan something and then we do something, we then need to check on its effectiveness. And if there's any issues that we see, we then act on them. And this brings us continual improvement, which means it becomes sustainable. It's not just a risk assessment that we've done once off. It's a risk assessment that turns into a management plan, something that you manage continually and improve on continually. So if we look at ergonomics specifically, we've designed the leadership program, we've designed a committee, we've set out who is responsible. And before we can actually allocate adequate resources, we need to identify an holistic approach to what tools are we using, the individual specifically, the organization that they're working in, the tasks that they're performing in, and even the different types of environments that this individual will work on. Then what we do is we look for methods or design methods in order to optimize the human, the individual, their well-being, and overall system performance. So ergonomics will lead to system performance, not just the ergonomic system, but the overall working of the actual company. This is what ergonomics is actually trying to do. We design everything around the individual. Now, you might think to yourself, well, this is way too much. We need to look at the physical capabilities of a person, the cognitive capabilities, the organizational capabilities. Yes, that is true, but it can be done. But it must be viewed as a strategic, continuous improvement process. In other words, you need to start somewhere. And only once you've started will you see the improvement coming along. Now, none of us are going to start in one day implementing an ergonomics program and having success tomorrow. What we will find is a continual improvement of the system to eventually design an overall holistic program. And holistic means that the entire company itself starts looking at health and safety and incorporating ergonomics as part of their risk-based thinking. Now, how do we do this? Well, the second part is planning. You must plan. Now, remember, without commitment from top leadership, without the resources, then this type of planning is not going to work. So what do we need to do? Well, we want to be specific. We need to be measurable. We need to be attainable in our goals. We also need to be relevant and time-based. These are SMART goals. SMART goals help us to take a look at the overall plan. Now, if it cannot be measured, it cannot be managed. So we need to look at the entire ergonomics program as a measurable item. First of all, what do you want to achieve? So identify your goals. You need to reduce musculoskeletal disorders, improve safety and productivity, increase training on ergonomics. All of these are good goals to achieve. But really, the ultimate goal is to prevent incidents and accidents in ergonomics from affecting our employees. Now, the only way to identify that is to first identify what is creating the ergonomic risks. Once we've identified those, we can set our goals and objectives in order to minimize or eliminate, if possible, those specific risks. We then set up key performance areas or key performance indicators. Once we've designed these areas of performance, this is now measured. And how do we measure it? Well, we need to constantly monitor and control, manage this type of ergonomics system that we are going to have. Again, set SMART goals. Use SMART, specific, measurable, attainable, relevant, and time-based goals. This will assist you in knowing what the outcome is going to be in a specific period of time. Again, we do not want to take too long with the system, and we cannot rush the system. So what do we then want to do as our third section? Well, the third step is hazard identification and prevention. Try and work these two together. When you do an ergonomics risk assessment and you understand all the ergonomic risks and hazards that relate to your specific task, try and identify then and there what the prevention method could be, whether it's putting in some sort of resource like a workbench, or perhaps training on the information, perhaps setting out schedules of timing where somebody who's using a jackhammer or a sledgehammer with vibration issues is not working that specific tool the whole day. So we rotate. We have one person using it for a certain period of time. They will then rest and perhaps do some other work that is not as stressful on the body while another person takes over. We might think to ourselves, well, this is not really going to work in our company, but have you tried it? Have you gone to look at the specific hazard identification in terms of ergonomic risks and assessed them? Look at the physical factors, the cognitive factors, the environmental related. This is the physical and social factors relating around the actual workplace. Then the type of technology or tools that you're using, as well as the organizational risk factors. What we want to do is work together with employees. And employees, please speak. If there is anything that you can contribute, remember keeping it positive. We don't always want to complain and say our employer never wants to do anything in terms of health and safety. That will start us off on a negative footing. What we want to do is say that we are available to make the system work. So have positive feedback. And remember, the person who is mostly affected by these risks are you, the individual. The employee working with these tools, the employee working in the ceiling, the employee bending over constantly or having repetitive strain on their body. You are the one that this entire system is designed around to protect. So be involved and give your support where it's needed. Now, we also want to have a risk map and we want to prioritize our risk. It's exactly the same as occupational health and safety. We always identify critical risks. So risks that are at the highest area or highest level of rating and try and eliminate those first, because those are the ones that are going to cause the deaths, the falls to a lower level, the obstructions to preventing us from achieving our goal in terms of having ourselves safe in a certain situation. So we want to stop critical hazards. We then move on to your less critical, your high, medium, and lower risks. Remember, by prioritizing, we might be able to achieve a system where a resource can be found that provides safety to a group of people and not just an individual. Now, why would we want to do that? Well, first of all, it's a lot more cost effective. You see, if you could implement the use of a scaffold in order to assist 5 individuals working on a roof platform. So you erect a scaffold around a roof platform so that there's no way for a person to fall off that roof platform. Now, if you think about that, a scaffold is pretty expensive, either to purchase or to hire from a subcontractor. To erect it, there's other things that you need to do. You need to inspect it every 7 days after inclement weather. You might need to have a scaffold team on site to do any changes. So there's a lot of extra if you might think about that, going into providing a scaffold around this area. But it is very safe for all 5 persons working on that roof. Now that assists all 5 of them to remain safe. The individual factor would be to give each person a lifeline and a safety harness and a lanyard. Now, this is first of all the lowest form of fall protection because it is now on fall arrest. You can't stop a person from falling. You can only stop them from hitting the ground. But it also only works individually and if each person uses it correctly. And so there's a lot of other factors, although it might be cheaper, it's still a higher risk. So we might look at the scaffold then that gives an overall risk prevention to all 5 persons without the possibility of being able to fall. So perhaps we need to weigh up, how are we going to not just prioritize our risk, but prioritize our resources that we provide to the specific risks? Well, it really depends on you. As an employer, as an employee, what we really need to focus on is being aware of the issues with ergonomics and then training ourselves on what is ergonomics, how are you going to prevent them, and what sort of roadmap are you going to take in order to establish a good risk management system for ergonomics. Remember, it is promulgated, it is gazetted, it's been here since December 2019. It is something that has to be done. It's the same as the Occupational Health and Safety Act. It's the same as the COID Act. It's the same as the COVID Act. All of these things have to be put in place. Now, the onus is on you, the employer, to put it in place, to design and implement an ergonomics management system. Why not do your training and awareness on this? Establish a training matrix. This matrix will identify the key persons that are involved, specifically top management and top leadership, and then each individual who might be involved in this type of system. And identify what they need to be trained in and when you are going to train them in. Things on ergonomic hazards and risks, the potential sources of exposure for ergonomic risk. And you can combine this into occupational health and safety training. When you do your next risk assessment training, why not ask the individual providing it to give you the additional information on ergonomics risk while discussing occupational health and safety? Make it collective. And then when you are training on this, hazard identification is very critical to the safe working of every employee. Every company has to establish a HIRA program, identify the hazard and assess the risk. Now, this can be done in a classroom. It can be done on the job training. But what it does is it helps us to understand what we are dealing with. And not only does it help us to understand it, it helps us to understand how to overcome these risks, how to protect ourselves from these risks. Now, employees, and this is something very, very important. I need to ask employees, yes, your employer is responsible for implementing this type of system, but you must work in accordance with the system. If you are given something in the interest of health and safety, it is your responsibility to use it the safe way. So please remember, everyone involved has a responsibility toward not just occupational health and safety, but also ergonomic related hazards and risks. Then finally, what we want to do is continually improve the system. It's the same with health and safety. Continuous improvement means we constantly identify and monitor what our objectives are. We look for those key performance indicators or key performance areas. Are we achieving them? Have we gotten our risks down? Now, how do we know about this? How do we know if we're getting it down? Communication. Please have good communication between yourself and your employer or your management. Identify what were your goals, what were the specific objectives in achieving a lowered risk in terms of health, safety, and ergonomics, and then annually revise it. If you can, do it every 6 months, but have an actual plan. Put it in place, monitor and review it, and see if you are actually improving. If you are not, maybe some changes are needed. And then remember, risk assessments must be kept. You need to adequately implement a risk assessment, and then monitor and review that risk assessment for change. The change of tools, the change of individuals, the change of environment as well. All of these are necessary in order to ensure the compliance to ergonomics regulations, but also in terms of compliance to Section 45 of the Occupational Health and Safety Act as well.